Well, something different this morning. Time to ask the doctors. A chance to learn more about exactly what frontline workers are dealing with when it comes to COVID-19 and other timely medical issues right now. We want to say hello to Dr. Ralph Riviello, who's joining us with University Health System and UT Health. Doctor, good morning to you, sir.
Good morning.
So we're about five and a half months into the pandemic, and I'm just curious how you frontline workers are holding up and how you feel things are in relation to getting a grip on COVID-19 and ultimately getting back to what we were kind of used to back in February.
Sure. So things are going pretty well right now. My staff are all doing pretty fine, coming to work, taking care of patients. Over the last week or two, we've seen a decrease in the number of COVID patients coming into the emergency department here at University Hospital. And we've actually started to see an increase in the normal, regular emergency department patients that we see.
That sounds fantastic. And yes, I think we would all agree the numbers seem to be trending in the right direction. Is it fair to say that Bexar County, that our area has kind of turned the corner, if you will, and on the downside of this whole situation?
So if you look at the graphs that are released by Metro Health and some of the other agencies, it does appear that we are on that downwards swing, and it looks like our cases are decreasing, our hospitalizations are decreasing, so those are all good signs.
That being said, I mean, we have seen places like the Well and other local places that have had these large crowds of people getting together. We've seen some smaller school districts, excuse me, that have already opened up to in-person classes, report positive cases. So how concerned are you as 100,000 plus students are going to start virtual learning today, that as these schools open up, even after Labor Day, that the numbers could trickle back up again?
Absolutely. I think that's always a concern. Anytime you start getting large crowds of people together in confined spaces, especially if they're not practicing good techniques like social distancing, hand hygiene, masking, all of those kind of things will help prevent the spread of the virus. And if we fall down on any of those measures, there's a good chance that we're going to see another surge of COVID-19 here in Bexar County.
Just from a medical perspective, how do you feel in terms of what you heard regarding school districts and the precautions they're taking, and those who have chosen to open to in-person classes right now? Are you concerned about those decisions, or do you feel, I mean, where do you fall on that debate, whether it's too soon to open or this is the right time to do that?
Sure. So I think it's a difficult topic to really, say that there's a right answer or a wrong answer. Personally, I would be very cautious if I had children going back to school. It's great to have a plan to contain the virus and what you're going to do at the school. But I think the real key to it is how it's going to be implemented, how it's going to be enforced, and what's going to happen when people don't wear masks or things happen around lunch and recess, and are they really going to socially distance? And what's going to happen after you start getting positive cases? Will you have good cleaning practices? Will you have to convert to all online classes? So I think it's still a moving target as to what's going to happen, but I think we have to have some, caution with reopening of the schools.
We'll have to wait and see. Of course, as flu season approaches as well, and that the holidays we would love to visit with you some more, Dr. Riviello, in the future. So thank you, and all the best to you and all of your frontline workers there. Stay safe.
Thank you. You too.
Yes, sir. Dr. Ralph Riviello there with the University Health System and UT Health. And, of course, we salute all of their efforts here for the past 5+ months. And